Your joint pain that you are experiencing, if you are in your 40s, 50s, and 60s, could be because of your hormone shifts of perimenopause and menopause, because there is something called the musculoskeletal syndrome of menopause. And that's why me, a physical therapist who takes care of women all day long, knows about this for years, but most of your healthcare providers do not. So here are things that we can do to help your joint pain. Number one, we need to maintain the integrity of your joint. So maintain your range of motion. So that can look like yoga. That is why mobility for yoga is very important, but also the breathing aspect of yoga is important, which brings me to number two. You need to learn to rest and control inflammation. Maybe you need to lay off a little bit. Maybe you do need to go to bed, because all that cortisol spiking from stress and burning yourself out is causing more inflammation. Number three, you need to start lifting and lifting heavier than 5-pound weights, because I need you to make more muscle, because sarcopenia, which is muscle loss, will come for you, because as our estrogen declines, our ability to make muscle is a little more difficult. So now we have to try harder to be normal. So I need mobility, I need you to rest to control inflammation, I need you to lift to make muscle bulk. And so our habits have to change. So you can't just wake up in the morning and feel good because you're high maintenance now. So it means there's some exercises you're doing. It means there's some supplements you're probably taking. Creatine is incredibly helpful for energy and post-workout recovery because it reduces oxidation. So if you are starting your weightlifting journey, creatine is really helpful for making your muscles, because it's giving you more energy and it's helping you recover. It technically doesn't change the muscle bulk situation. It just kind of helps you do what you're gonna do. And if you choose to take HRT, that is incredibly helpful as well. I know not everybody wants to, but I also take hormones, but I don't take estrogen. I take testosterone and progesterone. And when I started to take testosterone and started weightlifting, I felt incredibly improved. I could not believe. So I need you to know that your joint pain and all the stuff you have happening isn't in your head. It's crazy how fast this stuff comes on, how quick you can get tendonitis and how fast you can get pain. But we can do this. You just were never told you had to do this. And then there's this kind of mourning of how easy your life used to be, and now everything's high maintenance, but you get over it. You'll be fine. You'll get there. You'll have an epiphany one day that you are worth working for, you are worth taking care of, and future you needs you to do the things now. So you'll get there. I know you will. You'll have that epiphany. And I'm sorry to be the bearer of news that we have to exercise, but muscles are such a big deal. I don't know why we didn't realize it before. Love you, bye.